My name is Catherine Ferguson, and I'm going to do your exam today. Why don't you have a seat on the exam table? As I said, we're going to do a peripheral vascular assessment, and that's basically assessing your arms and your legs to make sure that you're getting plenty of blood flow to those areas and there's nothing unusual going on. Understand? Okay. All right, so first we're going to start off with your arms, and I'm going to look at each arm and just make sure I don't feel any sort of lesion or bumps or anything like that. Both arms look pretty good. You've got a couple of spots right here. Looks like you had an injury. One thing when I'm doing this is I'm making sure that that both arms are symmetrical. So that basically means they're the same size. If I thought they were asymmetrical, then I would go ahead and take a measuring tape and measure them at different areas and points just to see what the difference is. And possibly you would have to be referred to for something else. The next thing I'm going to do is I'm assessing and feeling for the temperature of your hands. Both hands feel warm. I don't feel any coolness, which would signify that you weren't getting enough blood flow throughout your arms. I'm next going to look for your pulses and feel your pulses. You have a strong pulse right there. And I want to make sure that those pulses are nice and even. And then I'm going to feel for your brachial and your ulnar pulse. Perfect. Very good. All right, so next I'm going to check your capillary refill. And basically I just press on your fingertip and watch the blood flow come back. So your capillary refill is less than 2 seconds. And that means that you've got good blood flow to your hands. The next thing I'm going to do is have you lie down on the exam table. And I'm going to do an exam on your legs and your feet, okay? So one thing I will do is I can first am going to check your legs. I see that you have nice pink warm legs. There's no lesions or marks. I'm going to check your other leg. Again, no lesions or marks. See, you've got full range of motion of your legs. I'm going to feel your pulse at your groin for your femoral pulse. You have a nice, strong femoral pulse. So now I'm going to check for your popliteal pulse. And this one's a little bit harder to feel just because of how deep it is. And I'll feel for your dorsalis pedis pulse. So that's nice and strong. So that means that you're getting good blood flow from the top of your legs down to your bottom ones. Your legs are nice and pink. I see no areas of blue or coolness. I don't see any venous stasis or thrombophlebitis. So one other thing I'm looking for is making sure that your hair growth on your leg is in a normal pattern. I'm also looking for if you have any pallor, which might show arterial insufficiency, or cyanosis, which is just your leg being blue whenever you're dependent, which would be, say, sitting up with your legs laying back or laying down, which can show venous insufficiency. I don't see any edema or swelling on your legs or your feet. Your edema can be 1+ to 4+, which and can be non-pitting to pitting, and just shows how much water you may be retaining, which can show things like congestive heart failure or arterial insufficiency and things like that. Includes our peripheral vascular assessment. Madeline, why don't you have a seat? Thank you so much for your help and being a patient today, Madeline. You're welcome.